Hey everyone, today we want to talk about peroneal tendonitis, which is a pain at the outside aspect of your ankle that can, in some cases, radiate down into the side of your foot because one of the peroneal tendons attaches at the fifth metatarsal base on the outside of your foot. The tendons run along a little channel just behind the lateral malleolus, which is the outside ankle bone of your foot, and into the muscles in the lower leg. In some cases, you may experience a popping or a clicking sound at the side of your ankle when you're walking, and that has to do with the fact that the tendons are, in that case, popping in and out of their channel. So if you're experiencing this type of discomfort, you'll want to assess with a physio to see whether or not that muscle is too tight or if it's too weak. If it's too weak, you'll want to do some strengthening exercises to tighten up the muscle so that the tendons are sitting in their channel properly and aren't popping in and out. If the muscle is too tight, you'll want to do some stretching to improve the function of the muscle and reduce pulling on those tendons so that they're staying in the channel along the outside edge of your ankle bone. Now, if you have an acute injury such as an ankle sprain that caused peroneal tendonitis, you'll want to do some rest, ice, compression, and elevation, which is the RICE method. You may even want to take some over-the-counter medication like ibuprofen to reduce swelling. If you do have a very unstable ankle, perhaps you're rolling out significantly, or maybe you're walking on the outside of your foot a lot, then what you want to do is stabilize that foot with either some orthotic support or maybe some wedging in the shoes. A really stable shoe can help that as well. So if you have a shoe that has an out flare as opposed to an in flare, that improves the actual function of the foot as well. It keeps you from rolling out. You'll definitely want to check whether or not your shoe is worn out. If you have a significant amount of wear on the outside of your heel, you will want to fix that shoe and improve the stability of it, which in most cases will reduce the pain. If there's other instability issues due to ankle sprains, maybe you have some ligaments that are no longer tight on the outside of your ankle because of an inversion sprain, the orthotic can really help improve the balance of the foot. If we do design an orthotic for peroneal tendonitis, most of the time what we'll do, we'll add more support on the outside edge of the orthotic. We'll either raise up the outside wall of the orthotic to provide more stability. If you have a really high arch and maybe that outside arch has a significant gap on the outer edge, what will have to happen is you'll have to fill in that gap with strong support to prevent the foot from rolling out too much and then reducing stress on the tendons that way. Or if you have a significantly unstable foot and it's a little bit more flexible, we can in some cases even add a cuboid block, which is a little bit additional support between the heel bone and the fifth metatarsal base that helps to stabilize that foot on foot contact. So it prevents you from rolling out too much. And it's like a little bump that fills in that gap on the outer side of the foot. Now, if you have any additional questions regarding peroneal tendonitis or there's something else you'd like to add to the conversation, please don't hesitate to post those questions and comments below. Otherwise, have an amazing day.